Just a second, Jen. Soon as it tells me we are streaming, we'll be ready to go.
All right.
Okay. We're
You're all
good.
set? All right. Well, good morning, everyone. Welcome to the City of Charleston Health and Wellness Advisory Committee. I'm going to be chairing the meeting today, as Councilman Shealy won't be attending. So just want to call the meeting to order at 8:30 and welcome everyone. And first thing on the agenda is review of the minutes. And if everyone read the minutes, do we have an approval for the minutes from the last meeting on January 7th?
Move to accept.
Okay, do we have a second? I can second because I was there. All right, well, we'll accept the minutes from the last meeting. All right, well, we'll start out with our community spotlight from Federal Healthcare Network. And is that you, Andrea, and your team doing that?
Hi, yes. My name is Andrea Holmes. I'm the Director of Risk and Corporate Compliance with Better Healthcare Network. And I have Ryan Hatchett. He is also on the call, at least I think he is. And he will share his screen and he'll give you a presentation and let you know some information about things we're doing in the community. Let me just check with him 1 second. I'm in this Charleston traffic. Forgive me.
All right, good morning, everyone. We're trying to get a screen to share for the presentation from Federal Healthcare for those of you who just joined us.
See, Ryan's on now.
Ryan, if you're on, can you introduce yourself and share your screen?
Hey, good morning. How's it going? I'm Ryan Hatchett, Outreach Program Manager for Federal Healthcare Network. How's everybody doing? Paul, good to see you, man. How's everything been?
Good morning.
Good morning. Good morning.
Good morning.
The share screen's open for you if you need it.
Okay, I'll get straight to it. I'm Ryan Hatchett. I'm the Outreach Program Manager for Federal Healthcare Network. And just a brief presentation about our outreach program, what we do, the importance of who we are, and how we serve our community. So with that being said, Federal Healthcare Network is a community-based healthcare center dedicated to providing high quality, comprehensive primary healthcare services to the communities that we serve. Our goal ultimately is to improve the health and well-being of the communities that we serve, overcoming those barriers that they often face. Thanks so much. Overcoming those barriers that they often face, whether it's from young age all the way to the elderly ages. We want to be able to provide services for them in every aspect of from food to our health services to behavioral health. Any way we can assist them, we want to be able to provide that service for them. Addressing the big issue are the social determinants and the health disparities that our communities that we serve face, and that's across the whole board. We range all the way out to your Walterboro, your rural locations like Hollywood, things of that nature, all the way down to our main site, which is off of 51 Nassau, downtown Charleston, and most of our patients are in this cycle that you see. And it's an unfortunate situation that in 2026 we have so many people dealing with these issues. Our ultimate goal, we want to overcome those health disparities. We want to let everybody know that they're not being overseen, their voices are heard, and there is assistance available for them. Oftentimes the people that we serve, they don't know what they don't know. But having those in-depth conversations goes a long ways to give an ultimate impact for them, and it helps to spread the word for not only themselves but their family members as well. Going back to education, I'm not sure if you knew, but 1 out of 12 people in the United States rely on FQHCs, federally qualified healthcare centers, and for Federal Healthcare Network to be the first FQHC in the state of South Carolina, we do take pride in that. But ultimately, educating the community is most important. We serve and participate in over 50 community events annually, meeting people where they are and connecting them with essential health services and resources. That goes with partnering with your local police department, partnering with Charleston Mental Health, partnering with Hope Center, and other partners, some that are on the line right now. I did see Mr. Lamar. We do community outreach events all the time where we're able to provide a space where tons of resources are available, and we can not only educate, but we can sign you up for appointments. Oftentimes we bring our mobile medical and our mobile dental units to those events where we're able to provide services and schedule future appointments. Also introduce them to our key partners. However we can be a resource, we want to be that resource, because nobody deserves to be in that cycle that I just recently showed. It's an ongoing cycle, and once you're in it, it's very hard to get out if you don't have the resources, or if you don't have the knowledge to find a way to get out of that. And we want to be that resource. We want to provide that and bridge that gap ultimately. Focusing on the homeless population. This is a very big issue in Charleston and the surrounding counties. And I feel that it is continuously increasing due to several reasons. And the elephant in the room, but we know that prices are going up, and money, people aren't getting paid as much, or the workspace isn't as open to others as it used to be, right? So you're seeing the homeless numbers go up extremely, and that when you see homeless go up, you see crime go up, you see people feel unsafe in the communities that they live in because of that. So it is a trickle effect to all of those things. So working along Charleston Police Department, Hope Health, community, Charleston Mental Health, and many other partners, we provide services that when we go to their shelters, when we go to the camps, when we go to the community sites on which they reside, letting them know that they're not overseen. They are important. They mean something to not only us, but they mean something to this community, right? Because once you feel like an outcast, man, it is easy for you to turn to negative things, right? And we live in a beautiful place in Charleston, South Carolina. I love it. I'm from Georgia, but I love Charleston, South Carolina, because of being close to the beach, the food that we brag about and rant and rave about. But it is very unfortunate where we can drive downtown. Like I said, I go to 51 Nassau every day downtown, and you're seeing more and more homeless people on our roads. We have the opportunity, and we do have the power to help change that narrative. And we're just doing the best we can to help bridge that gap and be that voice for those. Another way that we help and go out to our community is touching our future leaders of tomorrow, right? We're going to go educate with our school-based programs. We're serving Charleston County and Colleton County, and we bring our mobile unit to those schools. We meet with those students. We have the telehealth appointments with their parents. This often gives them an opportunity for the parents not to have to take off from work losing the paycheck, right? In the environment that we're currently in, but ultimately letting them know that, you know, their kids are safe. They we give them healthcare services at a discounted price because we do work off a sliding fee scale. And we have providers, we have a team that want to be there, that want to help build that community, helping the kids understand the importance of healthcare at a young age, right? You see a child who's dealing with a toothache or hunger issues, whatever the case may be, that turns into behavioral health issues, right? That turns into, oh, he or she shouldn't be in school because they're disruptive. I'm painting a picture of how that can ultimately turn into the people who were saying that I see on the roads when we're driving down when I'm driving to work. If we can address those issues at the beginning, and we can help them, and we can help them understand that somebody cares for them, even though they don't feel like it sometimes. Somebody does. You would be surprised with how many kids just want to have a conversation with us. You know what? What do you do? How do you do that? Can I do that? Is it possible that I can help and do healthcare? Yes, anything's possible. You have to put your mind to it. Yes, I truly believe, you know, but those conversations aren't being had, and typically they're labeled the bad apple before they can even get started, before somebody even understands what's going on with their life. So we offer those services where we can have our behavioral health specialists, we can have our dental team come over to the school, we can have our pediatricians come over there and provide services not only for the students, but we provide services for the staff members as well. All right. This allows them to not have to take off of work and leave and things of that nature, still being able to have those services taken care of at the job and get back to work like a regular day, right? This is some pictures of us in our outreach community, just serving the community, providing food to individuals, having those in-depth conversations with the children, as you can see at the bottom left, where that's a provider who doesn't have a white coat on, but is able to showcase, hey, yes, I'm okay with coming to paint your face. I'm okay with coming to have a conversation at your home. You don't have to come to my office all the time. I can let my hair down as well. I'm just like you. I probably once was a little girl just like you, and I had big dreams and I decided to chase them. It's possible. Having a group of fathers come together with their children and have a field day with the kids, having some ice cream out there, so we can have conversations about what's going on and how we can continue to better our community, but ultimately bring our children together, right? Which is important. Build that community for others and help educate on the importance of healthcare, wellness, overcoming obstacles, and striving to make a better community that we live in. This is some more pictures, and that's my whole presentation. If you guys have any questions, I am Ryan Hatchett. I'm the Outreach Program Manager for Federal Healthcare Network. Here's my contact information.
Jennifer. Ron, could you sort of maybe tell us where y'all are all located, the different centers, the clinics that you have in the
Yes.
Charleston area?
So we do have our 51 Nassau, which is our home base. You have our Enterprise location, which is in the North Charleston area. You have, do you want me to discuss like school based, like Mary Ford and them, or just our brick and mortar?
Well, we can go to school based, but I'm curious about Johns Island, or I don't. Are y'all just in Charleston and Colleton County, or are you in Dorchester any? Or?
We're in Dorchester as well. We're in Johns Island. We're in Hollywood, Walterboro, Moncks Corner.
Also Berkeley County, Berkeley,
Yep.
Dorchester, Colleton, Charleston counties. We have 23 locations. Some are mobile, and we have 12 big brick and mortar sites. We also have women's health, course, pediatrics, adults. We assist with behavioral health as well.
Yes. Thank you, Andrea. I appreciate that.
And we have mobile dental and dental at the 51 Nassau.
Yeah.
What does Johns Island's outreach look like?
What like serving that population, we do have a site out there where members go out there, and then if they have a community event, we go out there and assist.
I was trying to, is that the Sea Island Clinic or y'all's, where's your clinic at? Sea
Yes.
Island?
Yes, it's in that building. Yes.
And do y'all still have a delivery? I know at one time we were talking about infant child care. Do y'all have, how's that addressed out in that area?
Did you say childcare or delivery?
Delivery.
As far as medication or babies?
Well, I thought that y'all had gotten a OBGYN or,
Oh, yeah. So we do have OBGYN. We have an office in West Ashley. We also have a office in Somerville. Our providers don't particularly deliver babies. We work with the hospitalists through OBHG, and OBHG deliver our babies.
okay. I just remembered somewhere that for a while there wasn't out there, in a couple years, it could have been 10 years ago, that y'all finally had somebody in place to help cover some of that outreach and in
Yes.
that location. So
We do, and we are working with HCA, which is a GM, and they have a GME program. So they have residents that also travel with us. So when we do outreach, some of those interns will go out and assist us with patients. Normally, though, for the OB patients, if they need assistance, we do try to get them inside the clinic just because it's a safer environment for them. But we do have providers that make them get connected if they need to be seen inside our health center. And another thing we didn't mention is we have pharmacy services. We have Ford Pharmacy, and we also provide courier services for pharmacy. So if patients need medications delivered to their home, we do that. We also do mail order as well.
What's that?
y'all stay pretty busy.
We do.
Do y'all have any kind of needs that you got a lot of good voices around the table? And I know I saw many partners already mentioned between Low Country Food Bank and mental health and Department of Public Health and the school district. And I think it's covered about almost everybody that's on our list. But are there any concerns or needs that y'all are experiencing now in the federal health care network?
Well, just to be honest, we always are looking for collaborative relationships so that we can make those connections with our patients. So just trying to get with the individuals that are on the call that can allow us to have collaborative agreements, come into some of their environments, some of their events, just to host and also show what Feder can do for them as well as their patient population or their clientele as well.
Yeah, I would second that. If you have any upcoming events or opportunities for us to be in the community and serve the community, we're always open to that. Our biggest need, like I said, is just addressing the current issues that we have in our communities, right? It's unfortunate that we're in 2026 and the homeless population is continuously rising, right? And we see it every day, and we see the effects of behavioral health and things of that nature. And I believe we have a team in which we can help combat that, right? We have resources that we can help combat that. And being on this call, like you said, using our team members, I think that we can help overcome those issues because it is sadly taking over our areas, and it's unfortunate, it's unfair, right?
Ryan and Andrea, this is Jonathan at the VA. Ignorant question here, but I'm hoping you'll have some connections with us and vice versa, particularly with the homeless and some other populations. And if not, then I definitely would like to talk offline.
We refer over there, but we can have a deeper conversation offline because we do see a lot of veterans that come in.
Absolutely.
So yes, that would be great. Thank you.
Okay, wonderful. Thank you. I'll be in touch.
I have a question too, Ryan. Do you on your website or anything, is there like a planned when you're going to schools, do y'all know in advance when you're going and where? Just because we have a lot of mental health counselors in the schools and didn't know if they could be able to easily know when you're going to be at that school next.
So we send out a calendar to the principal and the nurse for the schools, letting them know when we're going to be out there. And that's typically how that works. We don't have it posted on our websites, but internally we have that communication across the board.
All right, that's great. Yeah, we have an RV too, and you never know when you got to change your plan, right?
Yes.
And we can share
So
that.
that's why we can't. That's why we
Share
can't
that
post.
calendar.
Yes, ma'am. I'm glad you understood where I was going with that one. Yes.
Yeah, well, thank you all very much. That's I didn't realize you were even as expansive as you are now. We've been partners with you guys for years, but that's really you're doing great things in the community.
Thank you.
Are you all part of any of the homeless task forces or meetings or things that leads us to our next speaker? I'm not sure if she's even on here, but I wanted to make sure that you all are part of some of the conversations and groups that are addressing some of our homeless issues.
We are. We work closely with Hope Health, definitely with them being our neighbor, pretty much 2 blocks away. So we go to those sites, but I'm always open to any other conversation. I work closely with Captain Ali, with him being in the community and serving the community, providing whatever education and services that we can. I'm down for it. So if anybody has more information or other opportunities, please feel free to reach out to me.
All right, great. We will do that.
Thank you.
And
All right, so I guess can we unshare the screen at this point? Thank you.
I'm
Any
not-
other questions for Feder? Thank y'all very much for that presentation. It was great.
Jennifer, while we're I'm trying to page Latasha right now, but I'd like to take an opportunity. I know everybody knows April, but maybe let April introduce our new employee wellness coordinator. April, you there?
Yes, I'm here. Sorry, I'm having some technical difficulties with all of my equipment, but good morning, everybody. How are y'all? Everybody doing good today? Good. So I think most of you, I've talked with most of you before, but I'm April Slinkard. I'm the Benefits and Wellness Manager for the City of Charleston employees. And I'm so excited that we are growing our wellness team and could not be happier with who we've added to the team. We've added McKinley Brooks Sumter. She is a amazing addition to our team. She is a alumni of the College of Charleston, member of their basketball team, which go Cougs. So I'm super excited about that. She is going to be helping us with employee initiatives and making sure that our employees have access to as much care, both mental health and physical health care as possible. So we are excited about all the changes and all of the initiatives and programs that we're going to grow together. And I'm going to let her just kind of do a little introduction of herself. McKinley, if you don't mind.
For sure. Thank you so much, April, for that wonderful introduction. Good morning, everybody. As April said, my name is McKinley. I'm super excited to be a part. Ryan, your presentation that you just gave was so special. It gives me goosebumps to be a part of something so special. and just my third day. So I'm super excited to get started. I hope to meet you guys very soon, and thank you so much for this opportunity.
Thanks, McKinley.
Well, thank you.
But Jennifer, I don't think Latasha, they had a long week with all this, everything going on. And I do want her to talk because I know, and we'll get her back if she doesn't pop in, but I wanted to get her here to just talk about, because I went to the Hope Center, which is on Meeting Street up near 180 Place. And I was so impressed with the operation the city has up there, that they have a day care that they do breakfast in the morning, and then they have a warming area for those that are homeless during the daytime, but they have wraparound services like mental health, the like Roper St. Francis. I'm sure the Federer and MUSC are tied in there too, but there's counseling, there's closets for men and women. It's nice to see that there is an alternative right now, trying to at least to be that navigational center inside the city, in addition to what MUSC's navigational center is on the east side. And I know that we were having conversations, and Nick partners with all of them and through Low Country Food Bank, but it's just, I was hoping to get that conversation started to know what additionally can be done, or what areas we need to work on with our homeless groups. So I will, if I don't get her today, later on, we'll get her back here, because I think it's an important subject for us to keep at the forefront. So we'll jump over down to Lamar, if that's okay.
Good morning, everyone. Lamar Hodges, Community Engagement Program Manager for the Department of Public Health. Of course, this morning, as you see that I am wearing my red, we are going in that space of sharing how it is important for American Heart Month. So I got a lot of red in my closet that I got to definitely be able to utilize for this entire month. So I just want to go into space of just giving that, as it is very important that we kind of bring that awareness. So, of course, this month is American Heart Month. Just sharing in regards to heart disease is the leading cause of death and disability in the United States. Of course, some factors kind of go in there with understanding that those persons who are more at risk, if they're smoking, usually obese, diabetes, and with high cholesterol. Oftentimes in situations, over 700,000 people die from heart disease every year. So there's a lot of work out there for us to do and kind of bring awareness to with understanding this chronic disease. One of the ways to reduce that is, of course, making sure you get your blood pressure and your cholesterol checked regularly. A lot of times in situations like, partnerships with, Feder, as Ryan has mentioned, and we always work with them providing those different resources. And then, of course, just being active, staying active when it comes to, and I mean physically active in that space, when it comes to reducing that risk as well. Having a healthy diet, those 5 food groups is very important. Making sure you're eating nutritious meals, and everything as it pertains to making sure that everything is not so much of a fast food there. Of course, understanding less salt, more herbs and spices. I've always kind of going into space with my nutrition background, always expressing that, we can season our food, but we don't always have to use salt to get that good seasoning that we need. And then, of course, in the space of making sure that we be mindful of course, from staying from smoking and vaping, and a lot of times in situations with those persons who are just kind of gaining more control over it. Of course, with the 1-800-QUIT now, allows for us to be in a space of making sure that we are taking control over our health even more. So as I think was getting ready to be shared, and Paul, if it's okay, you can share it again. It's just I know we're excited about February the 6th, this Friday at 10 a.m. Of course, our very own, our mayor of Charleston will be signing a proclamation for wearing red that day. So that's why I have to bring more red out of the closet. And this is in honor of Women's Health Heart Month. So we're just excited about being there. Of course, everyone is welcome to be there. So therefore, make sure it's going to be hosted at the City Hall. And of course, we're excited about that. With one of our community partners, of course, American Heart Association, working with their team on February the 28th at 8 a.m. We will have the Low Country Heart Walk as well. So the Heart Walk will be there as it pertains to on at the River Dog Stadium. Of course, you will need to register for that as well, but there's also an opportunity for us to, bring more awareness. So if you do not make it to the event on the proclamation on Friday, you have time on February the 28th at 8 a.m. to join us at the River Dog Stadium to be able to do the Low Country Heart Walk with the American Heart Association. And then the last thing that I do have that is shared there is the community baby shower. As you see, of course, Department of Public Health, Community Impact, as well as our good friends over there at FEDER, who will be, we will host a community event that's basically providing those resources out in the community to the families. And of course, this event is going to be hosted there in Midland Park Road. Some items that will be given, some baby items, as well as educational resources. We probably go in a space of providing resources related to safe sleep, our newborn screening that we also provide with Department of Public Health, as well as our postpartum new mom visits. Of course, there will be face painting there for the little ones, as well as, of course, Guard Harvest Kitchen will also be providing hot meals for families who do attend this event. So we are just super excited about all the love that we're showing for the month of February when it comes to our heart. So therefore, of course, we welcome you to all of these events and different ways that we can bring more awareness to our health and our wellness. Thank you so much.
Thank you, Lamar. Does anybody have questions for Lamar?
Lamar or Taylor, can y'all give us an update on the measles? I saw there was one case in the Midlands this week, and any of that or the flu, either any kind of updates?
Yeah, Lamar, do you have the latest, greatest on measles?
I do.
Okay.
Dr. Bell did send out an email recently to us. And of course, right now, currently, we have over 876 cases. 354 of those cases are people who are quarantined, mainly in the Spartanburg area, more so Greenville, Cherokee, in that area. So at the same time, we're constantly just keeping an eye in regards to that. We do have a force team that really works, about 92 DPH employees who are working tremendously towards making sure that we are staying on top of this. And this was as of yesterday, that the numbers that I did share with you just recently. Of course, in the same sense, we do have our dashboard, so dph.sc.gov. Going to our page and being able to kind of watch the dashboard, as they do provide updates at least 2 times out of the week, which is usually Tuesdays and Fridays. So we always want to make sure that we kind of continue to be in that space. As it pertains to new cases, the numbers tremendously grow because of the fact that, of course, there are still the spaces where persons are still going in other areas for exposure, not necessarily knowing. So we just kind of continue to make sure that we are just allowing people to understand what the measles are and what it is that the symptoms are as well, so that therefore we can kind of stay on top of it. And at the same time, we do, like I said, we have the dashboard that kind of breaks down the numbers and just who it affects the most in the spaces of based off of the county, how many cases we have per week. Excuse me, also even the space of going to those who are vaccinated as well as the age group. So we got all of that that is listed, and it's updated quite frequently on our DPH page as well. And I know, Paul, you're probably going to ask in the same sense. Yes, we have so far right now, we have not heard any cases here in the Charleston area. So, also in the same situation, I wanted to go into space for opportunity because I did heard you mentioned about the flu. So we're going in a space of more so. I just want to put that out there that, of course, with our health departments, we do have where we have the walk-in appointments for those to get the flu vaccine as well in regards to it. And so, of course, on our website, being able to call, come in and very well be able to get that flu vaccine because we know that, of course, that case is still going around as well. So.
I guess the question I had and April Slinkard had brought it up in one of our meetings earlier, but the herd immunity for Spartanburg was somewhere around less than around 90% or less with the measles. Do we know what Charleston looks like for those that have immune from at least have had the shots in our community? Are we up to that 95% or are we less than that or?
Well, Paul, I do not have the answer to that question, but I sure can get it.
Yeah, Paul, what I could add here, and I think the takeaway from the upstate, there were pockets of populations that were well below, in general, that herd immunity of about 95%. Where the outbreak began was in some schools, and some of the schools had a vaccination rate of around 20%. Now, these were private schools. They weren't public schools, so they weren't governed by the guidelines that the state puts out. As a whole, Charleston County tends to fare much better than that, a much higher vaccination rate. Of those numbers that Lamar just shared with us of the cases, roughly 90% of those cases are in unvaccinated people. So yes, certainly what we're experiencing in the upstate is were pockets of unvaccinated, primarily children, and measles searches for whoever is not vaccinated. It is extremely contagious. Unlike the flu and some other respiratory diseases, the measles virus is very, very light. It can remain in the air, floating around in the air for up to 2 hours after someone has even left the area. Whereas the flu and some other more common respiratory contagions are a lot heavier. They fall to the ground, they fall to the desktop, whatever. They don't linger in the air. So yeah, we as Lamar said, we can certainly see if we can get some numbers on the vaccination rates. But that's where the magic is. The higher the vaccination rate, the stronger the herd immunity, the less spread we have.
Thank you.
And Dr. Durst, I didn't know if you wanted to add something. She wrote in the chat that there was a segment done by Dr. Kent Stock about herd immunity in this area.
Yes, thank you. Can y'all hear me? I'm having a little trouble. Can you hear me?
Mm-hmm.
Yes, Dr. Kent Stock is an infectious disease doctor, and he did a nice segment. He does a lot with Roper and private in the area, and he did a segment, I think it was this week, about the herd immunity, and I believe it was a little bit lower than the 95%. It was, I don't want to, you'd have to look at it, it's either 94 or 92. But if y'all want to reference that, it was in one of the news channels. That was good. So he talked about that. And I will say, not so much here, but on the Department of Family Medicine to the South Carolina, we've been working with that with our public health committee, working with the residents and the doctors up in the Spartanburg and Greenville area. And I know recently a lot of the school teachers in this area were asked to make sure they were up to date with their immunity, either getting a booster shot or checking with their doctor or provider where they could get a titer to see if they were immune. So thank you.
Are most of the measles cases all in children, or is there a percentage of adults?
I don't know the exact amount, but up in the Spartanburg, it was a mix. But it does, like somebody had mentioned earlier, it is in more of the pockets in the schools and certain neighborhood groups, and they're trying to figure that out. And I know the DHEC up there is working, to try to get the vaccines out there for those that want to do the vaccines.
Well, thank you.
Thank you.
I read in the paper this morning that I guess the numbers seem to be not as bad as they have been going, so they're going down a little bit. I don't know if you guys could speak to that at all, but it was a little bit of promise because it just seems to just keep going. But
yeah, what we did see was, of course, a surge right after the holidays, which was expected. It's you see that with flu. You see that with more cyclical or annual contagions like that. So yeah, there's a slight bit of hope in those numbers, Jim, that you just mentioned.
we'll take hope. Okay. Well, I guess I'm gonna give my update last, and it may help explain why Latasha didn't make it here today. But so I guess we can go to the community health and wellness updates. Does anyone else have an update that you'd like to share?
Nick does.
Okay.
Sorry, Paul, just unmuting. Yeah, thanks, Paul. Yeah, Paul, as I shared with you, and I think I'm guessing you're going to put it straight up there now. Yeah, we have our annual Chef's Feast. This is the 27th year that we've been doing Chef's Feast. It's out at Trident Tech again this year. And this is going to bring together about 33 restaurants represented by 34 of our local chefs. We're all going to come together for an evening of celebration, but also an evening of drawing attention to the issues of hunger and food insecurity, especially with a focus on childhood hunger. So very much looking forward to that. And we probably are looking at anywhere between just over about 450 participants coming and enjoying the festivities of the evening and the opportunity to indulge in some incredible food from our chefs, but very much with a focus on the theme of childhood hunger. So very much looking forward to that. If anyone is interested, Paul, I think if you haven't already, maybe you can share this, but please feel free to go onto our website and there's more information on the event as well. I think we have a few tickets still left if anyone is interested.
And I will add, it's one of the best events I've ever been to in my life, and it has such a great impact. And the money that you raise for child hunger is just we can do nothing but applaud y'all for all your work.
No, I think for me, it's always incredibly inspiring to be in a forum where you've got such committed and dedicated members of the community who are just stepping up and wanting to make a difference. I mean, that's the humility of that is incredible, especially at these times.
Well, thank you. Just any questions for Nick from anyone? Okay, any other community updates?
I think Jonathan had some good comments from his last coalition meeting that he shared. And I don't know if Jonathan, you want to talk about some of what your team is looking at for how to get the message of 988 out.
Sure. So interestingly, I think the state we're all kind of coming together to the same conclusion that we need to raise more awareness. So at the same time that the coalition, it's the Veteran Suicide Prevention Coalition. It meets the third Tuesday of every month. North Charleston American Red Cross, and anyone is welcome to join. It's not just to focus on veterans, but all populations that are feeling despair or down. And so we know at the same level, and Jen can certainly speak to this as well, but there's a survey that is going around for businesses that if they're interested in receiving 988 signage and be able to put it up in a public facing area, that is going around. But for the coalition, for the longest time, we've wanted not only to get more 988 signage and the veteran crisis line, which is the same 988, but option one, around the Tri-County. We're also very, very interested in working forward from what Mayor Burgess and the DOT were able to come up with and have that barrier put up over the Ashley Phosphate overpass. And so we're wanting to enhance those. And of course, we're well aware of the student that had taken his life off of the Arthur Ravenel over Halloween, and then also what had occurred with the Don Holt Bridge. I believe that was in December. So the needs are there. And so we're working primarily right now with North Charleston in that they've really stepped up the initiative. Again, with that Ashley Phosphate. And then we've had an opportunity to partner up with the Berkeley County Park and Rec. Unfortunately, they've had some deaths by suicide at one of their boat landings. So when we had met with the director there, they have 7 boat landings. They were more than happy to accept 15 signs if we could get them to them. So we're working with Office of Mental Health, with Tracy Meeker there I didn't realize that the state had a 988 coordinator. So it's wonderful. So we've connected and partnered with her, and they're producing the signs as we speak. So we hope to be able to hand them off to the director and get them at all of the boat landings. The bottom line here is, spreading a message of hope, making sure folks are aware. I don't know, Jen, what the percentage is of the population that still is not aware of 988, but it's pretty staggering, but it's only because I work in that field. I'm like, how do you not hear this? But it's still a great population. It's not aware of what 988 is or what they offer, which is not necessarily just somebody who is having suicidal ideation and thoughts. It's somebody who's just maybe having a bad day and needing to talk to somebody, or maybe just needing to talk to someone. So as upstream as we can make it, that's what we would like. And the crisis calls are equally as important to be able to respond to, but if folks can get kind of ahead of the game, if they're beginning to see kind of like those social determinants of health that Ryan was speaking to earlier, we have a better success model and outcomes. So I didn't realize I was going to say all that, Paul, but you put me on the spot. So hopefully that kind of addressed a lot of it. The coalition itself is going on 2 years in April this year. It really has taken a while to get some traction, to get the right people to the table. So it's, really that model of slow and steady, but let's build it and do it right and get a good foundation. And I feel like that's where this coalition is currently. So all of us are really excited about 2026 and what all that's going to prevail and look like for the Tri-County. And again, anyone is welcome to join up with us or just come to a meeting and participate. We'd love to have you. And if there's anyone else that's interested, I'll send the flyer to Paul. And that way you'll know the address and other detailed information. Thank you so much. Paul, I think you might be muted.
Paul, you're muted.
I was actually trying to talk to Latasha, and she thought the meeting was at 9:30, but she's trying to get on now. So, sorry. But I just wanted to add to what Jonathan was talking about, getting communication, not only 988, but North Charleston, I noticed, and I know Charleston's talking about it, and hopefully Latasha will briefly mention it, but North Charleston put up at some of their bus stations a little QR code that sort of, for those that are homeless or those that are desperate looking for answers to help, that they could hit on their little phone, and most homeless people have phones, to get a QR code to take them. Really, I think it goes to 211.org, and it's sort of a resource that they could find food, shelter, whatever it might be. So I'm glad to see that things are at least being discussed out in our community and coming up. And with that, Jennifer, I know you want to go over what mental health is, but we also have Latasha has joined us now. So however you want to go, you want to do yours and then we'll let Latasha end up.
No, let's let Tasha go first. That's because I was going to fill in probably some things she might mention, but now that she's here, I don't have to do that. So
Jennifer, you so sweet. Good morning, Paul. Good morning, Jennifer. Good morning, everyone. How y'all doing this morning?
Doing well.
we're great.
Good, good. So for those of you that I am not familiar with, my name is Latasha Jenkins Flood, and I'm the Executive Director of the Hope Center. The Hope Center is a homeless day resource center located in downtown Charleston at 529 Meeting Street. Paul, I wasn't sure if I was supposed to do like a presentation because I had a PowerPoint ready, or if you just want me to talk. You tell me what you need me to do. You on mute, Paul.
You can do the PowerPoint. You have the share screen on.
Okay. A second. Thank you, Paul. I'm going to get it and then I'll start sharing my screen in just 1 second. Okay. Thank you.
If while she's talking, if everybody knows where the Hope Center is, it's right on Meeting Street, just past where I-26 comes in. It's north of where I-26 comes onto Meeting Street. Right across from Lee Street is where the Hope Center is located. Are you able to pull yours up?
Yes. Can everyone see it?
Yes.
Okay, great. Thank you. Can everyone hear me okay?
Yes.
Awesome. Thank you. So again, good morning. My name is Latasha Jenkins Flood, and I'm the Executive Director of the Hope Center. The Hope Center is a homeless day resource center. We're located in downtown Charleston at 529 Meeting Street. The Hope Center was a concept of former Mayor John Tecklenburg after the tent city was dismantled in order to determine as a community how we could better serve the unhoused. Mayor Tecklenburg believed that that population needed to have one central location where they could come and get comprehensive wraparound services. Hence, the Hope Center was born. The Hope Center actually opened our doors to the public on June 6th of 2022. We have 7 staff members currently on site, including myself, 2 peer support specialists, 2 outreach workers, 1 employment assistant person, 1 social worker, an intern, and a host of other volunteers and service providers that partner with us. Please forgive me in advance if I share with this group anything that's redundant or something that you already know, but I never want to assume that my audience is aware of homelessness or how it works. I just wanted to give really quick what the definition of homelessness is. So according to the Department of HUD, homelessness is defined as people who are losing their primary nighttime residence, which may include a motel or a hotel or a doubled up situation within 14 days, and they don't have the resources or support networks available to remain in housing. They can also be families with children or unaccompanied youth who are living in an unstable environment and are likely to continue to live in our state. There are also people who may be fleeing or attempting to flee a domestic violence relationship, sexual assault, stalking, or other dangerous life-threatening situations related to violence that have no other residence or opportunities to get permanent housing. The categories of homelessness that we see here at the Hope Center are chronic homeless, which are individuals who've been homeless for extended periods of time, usually a year or more. They've had repeated episodes of homelessness, and they often have long-term physical or mental health issues, substance abuse, or severe economic hardships. We also have clients who experience transactional homelessness, which are people who are temporarily homeless because they lost a job. They may have had a family crisis like cancer or an eviction, and they usually sometimes have access to support or resources, but that may not always be the case. Our next category of homelessness is episodic homelessness. Individuals who experience frequent episodes of homelessness, often due to underlying mental health disorders, addiction, or lack of social support. And the hidden homeless, those are our clients who do not have a stable or permanent place to live, but are not typically counted in official homelessness statistics. Those include our children who are a part of the McKinney-Vento program, who usually couch surf with their families that are living in temporary, inadequate conditions or in places where they shouldn't be living. I'm going to also just mention really quickly that we have seen a rise in the amount of unhoused youth in our community that have become homeless. We've seen also an increase in the amount of clients who live in the country who are experiencing homelessness, in addition to our families. And 1 out of 4 homeless men in our country are veterans, are currently experiencing homelessness at this time as well. And I'm a fast talker, you guys. So if I'm talking too fast or if I need to slow down or go back, please let me know. I wasn't sure how much time I had, and I wanted to be respectful of the other presenters. Where do people who are homeless live? According to SAMHSA, homelessness happens at shelters, vehicles, outside, abandoned buildings, encampments, SROs, hotels, motels, or transitional housing. Who are the hidden faces of homelessness? The hidden faces of homelessness are people that are coming home from prison or a correctional facility with no plans for permanent housing or shelter, people that are exiting hospitals, mental health facilities, and other treatment centers with no plans for permanent housing or shelter, or people that are couch surfing or living doubled up with others in a temporary arrangement. I also like to talk about some facts in our state. I think it's important because people are often curious as to why a person becomes homeless or how homelessness happens to people. I just wanted to share with the group that the minimum wage in our state is still $7.25. The average rent wage is $17.08. In order to afford a 2-bedroom house here in Charleston, you have to make at least $21.48. We have a total of 586,430 people that rent. The percentage of renters in our community is 30%. And in South Carolina, the fair market value for a 2-bedroom apartment is $1,117. And in order to afford this payment without a person paying more than 30% of their income for housing, that household must earn at least $3,723 per month, or at least $44,674 a year if that person is working 40 hours a week, 52 weeks a year, making $21.48. Some facts about our states. 25% of renters in South Carolina are extremely low income. 88,193 is the shortage of rental homes that are currently not available in our state for extremely low income renters. Excuse me. $28,190 is the average income limit for a family of 4 who are living in extremely low income households. And $50,085 is the annual household income needed in order to afford a 2-bedroom rental home at HUD Fair Market in our county. Causes of homelessness in South Carolina: economics, poverty and unemployment, unaddressed mental health issues. Circumstances that also contribute to homelessness in our state. Homelessness in South Carolina is influenced by a variety of economic factors. Some circumstances that contribute to homelessness in our state are affordable housing shortages. South Carolina, like many other states, have seen a decline in affordable housing. And although housing prices continue to increase, wages have not kept up with the cost of rent or home ownership. Many individuals or families simply cannot afford to live in urban areas like Charleston, Columbia, and Greenville because the rental markets are so competitive. I provided a chart for the group to see where you can see 50% area medium income, 80% area medium income, and 100% area medium income. ELI stands for extremely low income, and these are the households and available homes in our county for families who are looking to rent. Where category 4 is, there is a short little green bar there. That bar wouldn't let me be great. It was an error and I was trying to delete it and I couldn't get it to delete. So I just left it there. So that green bar doesn't mean anything. I just couldn't figure out how to get it deleted. I also thought it would be helpful to show a demographic snapshot of what extremely low income renter households look like in our state. And I made a small cliff note again at the bottom. Sorry, let me go back to that one really quickly. And those categories include senior citizens, people that are disabled, people that work in the labor force, high school, single adult caregivers, et cetera, et cetera. I just wanted to give a snapshot of what those specific demographics look like as it pertains to low-income renter households. South Carolina has a high proportion of low-wage jobs, and many of these jobs don't pay enough to cover the basic living expenses like housing, food, and healthcare. Although South Carolina has a low unemployment rate, they still don't provide many employers enough hours or benefits to serve a housing or provide financial stability for many of our families. Additional circumstances that contribute to homelessness in our state: evictions, particularly in Charleston's competitive rental market, can lead to direct homelessness. Many tenants face evictions after falling behind on their rent. And according to the Eviction Lab, again, the average rent in Charleston County is $1,605 per month. And if a landlord chooses to file an eviction for a person for any reason, even if that person is only 1 day late on their rent, they just need to give their tenants a 5-day notice and pay a $40 filing fee to the clerk's office in order to begin that eviction process, which hurts a lot of our families. Some highlights again about our eviction facts in the state: we have had 39,714 evictions filed since March 15 of 2020. For 2025, we had 10,353 filings during that year, and then we had 840 filings in the past month from the year 2025, December. Also, eviction filings for African Americans, they make up 31% of the renters in Charleston County, but they consist of 52% of the people who evictions are filed against. Latinx or our Hispanic populations make up 6% of the renters in our community, but they also consist of 8% of the share of eviction filings. Caucasians make up 36% of the evictions and 58% of renters in our Charleston County community. And female renters, even though they make up 58% of the population, they also are 53% of the population that have had evictions filed against them. I also thought it was important to talk about the poverty line. I won't read the chart line for line. This chart and this presentation is available to anyone who would like to have it after the PowerPoint is over. I just wanted to share some information about poverty and unemployment and how the poverty line is impacted in the groups that are traditionally impacted by poverty and unemployment in our state. Also, Jennifer, feel free to jump in any part of this presentation with the mental health statistics. I thought that this was important. I wanted to find out how many adults with mental health issues were in our state. At the time of my research, it was 17.4. Adults also consisted of 66.4% of deaths of despair. And for those clients that have depression who receive Medicare, they make up 18% in our state. Mental health plays a very important and vital role and is directly correlated to homelessness. And for clients that do not get their mental health issues addressed, they're more likely to become unhoused. So I know I said a lot, you guys, and my biggest takeaway for the group would be this: what can we do? What can we do? We can advocate for the creation of groups such as the Affordable Housing Strike Force. This group was a group of real estate professionals that received guidance from the city, and they were able to get 40 public land projects through the development line, which created affordable housing in Atlanta. I created and shared the link for anyone that's interested in reading more on how they were able to do that in Atlanta. In Chicago, they also created the LaSalle Street Reimagined Initiative, where they took vacant office buildings and they repurposed them and were funded through the TIF and other proceeds. That's another thing. The third way we can assist the unhoused in our community is to support Mayor Cogswell's Regional Rapid Shelter Initiative that he is currently pitching to the region. Also, we should all be attending our local city council meetings just to advocate for the unhoused. You can always donate to organizations like the Hope Center, where we're located at 529 Meeting Street. Our website is hopecentercharleston.org. And if anyone has any specific questions, comments, or concerns about the Hope Center, if you're interested in doing a tour at the center, please feel free to reach out to me and I'm happy to assist. Are there any questions for me?
What does your network of and many of them are in this room on the Zoom today, but what does your network look like?
So we partner with a variety of faith-based partners. The great services that we do here at the center would not be possible without the collaboration and partnership of our faith-based partners. In addition to that, we partner with 180 Place. We partner with Star Gospel Mission. We partner very closely with the Department of Mental Health. We partner with Palmetto Project for our unhoused clients who need insurance. We partner with the Department of Social Services for our clients that need assistance with applying for SNAP benefits or other benefits that they may qualify for. We also partner with the Charleston County Public Library and the Low Country Food Bank. They are very critical in providing the breakfast that we serve to the unhoused population 3 days a week here at the Hope Center. And we also have other donors and organizations that may support us that don't want to be mentioned to the public and just want to do it privately, and we honor that request.
Anything we can do to help you?
Yes. Any opportunity that you get to talk about how the unhoused need support, that would be great. We are always looking for volunteers to assist with breakfast. Breakfast is 1 hour a day, 3 days a week. We are currently rededicating and reestablishing our clothing closet. So we're looking for brand new or gently used items. We always have a great request for families that are facing eviction prevention. So we always use those kinds of services. We have families that are living in hotels that are at risk of being displaced because they can no longer afford it. So financial assistance is always needed. We also need talent of people like this group who can help us plan additional fundraisers, whether it's a walk run for the unhoused or whether it's a concert where all of the benefits will benefit this population. And we sometimes just need people to come and give our unhoused population words of encouragement. It's hard being homeless. It's easy to become invisible. It's easy to feel like you don't matter to people and that you're not seen. So sometimes just a word of encouragement is very helpful to this group that we serve.
Great. Thank you.
I think, Lamar, do you have a question?
I don't have a question, but I do have just a statement to make. Well, it's great to see Latasha again, as always, as we are normally in a lot of meetings together. So it's great to see her. And I also wanted to share with her that, of course, community engagement, we did have an initiative that we are currently working on when it comes to just providing resources out there for those who are unhoused. And so therefore, I definitely want to go in a space of letting you know that we will be in touch soon because we have some items that we want to provide to you guys as well.
Thank you, Lamar. I appreciate that. I look forward to speaking with you.
Yes, yeah.
What other questions you guys have for me? This is a quiet group. I was expecting a ton of questions, Paul.
You answered them all.
Oh.
I think y'all yearly do a count of the homeless. Have y'all? I thought y'all were starting that already, or every month or so. Have
Yeah,
y'all
we
done
did
that?
it last week, Paul. We finished it on last week. It was the point in time count. It ended on last week, and we're still going through those numbers. The 2024 South Carolina State of Homelessness report just came out as well. So if anyone is interested in reading, that will give you a snapshot of all of the numbers from the previous year. And then this year's numbers will be in the latest edition of that report for 2026.
We're proud of you,
Yeah, thank
of
you.
your team.
Thank you. Thank you, Paul.
All right. Does anyone have anything else you would like to share?
Jennifer, don't forget to mention your mental health
I know, I can't not share the conference, our Low Country Mental Health Conference coming up on July 29th through the 31st. We'll send a link to Paul again for the website. We have about 99% of our speakers ready to go, and we're excited about it. It's another great conference at the Gilliard, and it can be virtual or in person. So please join us. It's not just for counselors and medical people. Lay people can go to and learn lots of great things about mental health and alcohol and drug treatment or just whatever. So I'll send a link for that. And I was going to say, Latasha, maybe I can share some of this next time as to why she might not have been here, because we put her to work so much with a homeless response system mapping that we did. So I could maybe give an update on that next time. But I figure we gave Latasha so many jobs to do. That's why she couldn't be here. That's what I was going to tell him, Latasha. But anyway, so I appreciate everything that you're doing, Latasha, and everybody. But if we don't have anything further, we're a little behind time, so I will just adjourn the meeting. It's 9:40. And
Thank
everybody
you.
have a wonderful day.
Thank you very much.